Philippine President Rodrigo Duterte directs state-run insurer Philhealth to cover the expenses of COVID-19 patients receiving care from tents outside hospitals. This after Philippine lawmaker Ferdinand Gaite revealed some hospitals are charging patients staying in temporary tents 1,000 pesos per hour while waiting admission. Malacanang adds expenses on swab tests as well as isolation and hospitalizations for mild and critical cases must also be covered by Philhealth.
As the author of the Universal Healthcare Law in the 17th Congress, lahat po ng Pilipino miyembro ng Philhealth. So wala pong dahilan para hindi Philhealth ang magbayad ng inyong PCR test kung qualified ka makakuha ng PCR test. Yung ikaw ay nasa isang lugar na maraming kaso ng COVID-19, ngayon 20% ang ating positivity rate. Sa akin dahilan na yon para magbayad ng Philhealth. At patuloy naman po ang pagbabayad ng Philhealth, So hindi po hadlang kung hindi kayo miyembro, hindi kayo rini-require ng kahit anong ID, kinakailangan lang po ang pangalan ninyo at bibigyan naman kayo ng number ng Philhealth.
The Philippine government is ramping up construction of isolation facilities to decongest hospitals, dealing with the surge in COVID-19 cases. Health Undersecretary and Coronavirus Treatment Chief Leopoldo Vega says an isolation facility in Subic with a 250 to 280 bed capacity will soon be operational. Vega adds government will also open 2 isolation facilities in New Clark City for mild and asymptomatic cases.
So in other words, if we are able to provide more isolation facilities or beds and for quarantine, I think this will decompress really the hospitals. But it needs a very good triaging system with the local government in trying to sort out those who are mild and of course asymptomatic to be placed in this isolation or quarantine facility.
The Philippine Red Cross will also help cities in Metro Manila set up new isolation facilities in select public and private schools.
We're starting in Ateneo on Thursday. It's about Tuesday or Wednesday, but we still have to put the showers, and the Ateneo is willing to give us up to 16 to 38 rooms. The general objective is to remove the asymptomatic spreader in a household where there are multi-generations.
Meanwhile, private hospitals renew their appeal to the national government for additional healthcare workers. Dr. Jose Rene de Grano, president of the Private Hospitals Association of the Philippines, says additional equipment like hospital beds are also needed.
We have very limited healthcare workers right now. We can't get any additional nurses. But usually government will send augmentation personnel only to the government facilities.